Jenny Montague has spent countless hours peering and poking in tide pools and staring longingly at the ocean, as I'm sure everyone in the audience has as well. Her career began with marine mammals at a park near her hometown until she came to the aquarium 25 years ago. Jenny's experiences have allowed her to observe and learn about the health and social dynamics of wild dolphins, and participated in the rehabilitation and release of wild seals, dolphins, and whales. As the assistant curator of marine mammals here at the aquarium, Jenny has been lucky enough to share long relationships with seals and sea lions as they captivate countless visitors through public display. Please welcome my colleague, Jenny Montague.
Tonight I'm going to speak about a project that I did. There's a professional award here at the aquarium called the Cunningham, the John H. Cunningham Award, and it's for professional development, professional enrichment, and it's something that, as Gina said, I've been here for a number of years and hadn't applied before, and it seemed to be perhaps overused, but the perfect storm of timing for me to apply for this. And it is focused on learning how to take blood from seals and sea lions, and that'll be the focus of the evening. But I promise not to get too graphic. There are a couple parts in there, and I'll give you a warning. So if anybody's a little squeamish, there's your heads up. So let's go ahead and get started. The history of blood collection here with fur seals. Northern fur seals are a relatively new species for us here at the aquarium. We exhibited California sea lions for many years. Northern fur seals arrived here approximately 2007 or so. For someone like myself who's been working with pinniped seals and sea lions for many years, these guys were just a shot in the arm. They're a very different animal than sea lions. No less intriguing, no less fun, no less intelligent, but just different. Sea lions, a gross analogy perhaps, is that sea lions are a little more like dogs. If you're trying to teach them something and they're not sure, they're a little hesitant, you can just cheer them on. Come on, you can do it. And they're like, oh, okay, I can do it. And the fur seals, you cheer them on and they look at you more like cats. And it's like, I don't know why you didn't get that I said no the first time, but I'm just going to leave now until you get it clear. So that's really been a fun part for me as a trainer, to work with these very different animals. The northern fur seals, if you're not familiar with them, they are considered an eared seal. There are basically two species of seals. There are the eared seals, which are all sea lions, and all fur seals. So they have the ear flaps, large front flippers, able to rotate hind flippers, and walk on all fours. Every other seal in the world is an earless seal. So they have small holes for ears, short front flippers, and they're a little ungainly on the land, I suppose, and they move around a little bit more like an inchworm. So the northern fur seal is an eared seal. They are they run all the way north into the Bering Sea. Their furthest south location is right around Southern California, so quite a range. Their main breeding islands are off the coast of Alaska, about 300 miles west. So all you ever needed to know about a fur seal, except for the flippers. It is all in the flippers. That's what we're going to be talking about tonight in terms of blood samples. This is the hind flipper of our adult male fur seal, Isaac. You can notice the toenails in the middle there. The bones of the fur seal's hind flipper run all the way to the toenails, and they stop. And from there, they can actually fold that flipper forward. It's like a cartilage. It'll just bend at the end of the bone there, so they can scratch themselves, or they can keep that flipper open and they can groom. The northern fur seal is the second hairiest animal in the world. They have 300,000 hairs per square inch. They're second only to the sea otter, which has 1 million hairs per square inch. So they do spend a fair amount of time grooming with those hind flippers, and they are enormous. Much larger than any other seal or sea lion, primarily for that grooming. They're about 1/3 of the length of the body, I would say. This is the underside, or the ventral side, of a northern fur seal, and you may be able to see vessels. You're seeing parts of the bone at the top there, and some of those ridges, I don't have a good pointer here, but some of those ridges are vessels, and that's really the area that we take blood from. You can also use your hind flipper as an umbrella, a little parasol. This is one of my favorites, but that's a great opportunity to see how that flipper bends forward. Now, teaching the seals to participate or cooperate in a blood draw, we have a variety of positions that we use, and we base it really on what the seal's comfort level is. Are they a dominant animal? Are they a submissive animal? Where on the exhibit are they comfortable? Do they startle easy around other animals? going to walk you through that a little bit right now. This is a video of Sierra. She's one of our California sea lions, and she's learning to do a flipper presentation in the water. This is in our behind the scenes area in our holding room. There we go. Whoops. And so you can see she's got the trainer there has a tourniquet, and she's just going to tie that around the flipper. It's the exact same one you would get if you were at the doctor getting a blood sample taken. And we find that sometimes with the seals and sea lions, we benefit from a tourniquet, or we might use a hot pack to try to increase the blood flow to that area. And this is just going to be taking about a minute or so. And what we do is we start very slowly, and we'll work up duration until somewhere around 2 or 3 minutes when we think we can take the sample. But what we've been finding is that the vessels in the hind flippers are inconsistent. They're a little bit better with the sea lions, but with the fur seals, oftentimes we'll start to get a good flow, and then it stops, or it goes very slow. It's like molasses. We've taken to having the animals running around a little bit, doing a lot of aerobic exercise to try to increase the blood flow. One thing that also is very interesting about seals and sea lions is that they can control the amount of blood that goes to their hind flippers. They're able to regulate their body temperature this way. So when we saw Ursula, the fur seal with the little parasol of the hind flipper, when you see those flippers spread out like that, they're increasing the surface area, and if they're trying to cool down, they'll increase the flow of blood so it gets in contact with the cooler air. So it's that may be one of the other reasons that we're not getting great flow all the time for blood samples from these hind flippers. This is another video of my colleague Vanessa, who is just going to show a different way that we would work with the seals. She's, rather than having somebody feeding throughout the whole process, she actually is just working with this animal by herself. She has a second person there, but nobody's feeding during it. So you can choose to feed through the process, or ask the seal to just lie there and be comfortable. And you're going to see her going ahead and, sorry, I'm just having some issue with my mic there. She'll go ahead and move his hind flipper out. And she's just placing her hand on his flipper. And this, to get to this point, really from an animal that is naive, that hasn't really done any training before, it could take you several months or longer. And to do the actual full blood sample can take, again, several months to many more. It really just depends on the animal and the trainer and the process. Some animals, I personally find that some animals are wonderful for medical behaviors. They just, I'll sit here as long as you like, poke and prod, I'm fine, I'm just going to sit here and enjoy myself. And other animals are just a little bit more athletic, they don't want to sit still as much, and they're just a little nudgy, so you just have to approach each animal a little bit differently. So you can see she's got a second person here. This is one of our volunteers, and she is playing the role of the vet here. And we always have 2 or 3 people. We try to bring out all of the equipment that we know that the veterinarians are going to use to take the blood sample, or the biologists, the members of our animal health department, so the animals get accustomed to all of that. And then this is just one more technique. This is Chainsaw, who was the first seal that was with us many years ago, and Paul worked with her. And again, you're finding where the animal is most comfortable, what position they like, and so she tended to like to roll her hips over, and Paul had her flipper turned over in front of him. And we found through the process of this that she just wasn't sure what to do with that other flipper, and she'd often move it up and wiggle it around, and so finally she just settled on this posture and thought that was the most comfortable, and Paul was just fine with that. He said, okay, I'll just work right here. So this is we're actually taking a blood sample here. This was not a trained seal participating. This is one of our seals, but it was actually a restraint. Our goal is always to do this through training and cooperation, but occasionally if an animal's ill or they haven't finished the training process and we just need a routine blood sample to monitor their health, this is what we'll do. And this is, you can see there's a line from the needle, and that's just a little bit of tubing that runs to the syringe. That tube almost, well, I shouldn't say almost always. If you hit it, you'll get blood in that tube often, but it doesn't translate into the syringe very well. And we're not sure, again, if the blood's being slowed down or if the vessel's just not large enough. We're certainly having no trouble seeing them, but it just hasn't been a great flow. We've had moderate success with adult animals like Isaac here. I think in good part because his flippers are so enormous and his vessels are much larger that we have had pretty good success with him. But again, if he's cold, not so much. But what are we going to do about the babies if they need some blood samples? We've been just very fortunate these last few years to have a couple of baby fur seals, northern fur seals, born here. They're called pups. And we've also had a couple come in from a Stranding network. So we've got a full nursery right now. And obviously we'd need to get some blood on these guys. And if we thought Isaac's vessels were small, it's going to be a lot smaller here. So we could wait for them to grow up before we took a blood sample. But there is another way, or is there another way? Years ago, how many people have been to the aquarium over their lifetime, or let's say, were you here 20 years ago? Okay, so some folks remember the Discovery. Yeah, we had sea lions, California sea lions there. We had some big males. We had Guthrie and Tyler, our biggest guys at the time, who were sometimes 800 or 900 pounds. And we had tried to do flipper blood samples with them as well, with similar success, you know, and the success is inconsistent. So we had heard from about a fellow that was working down at the Roger Williams Zoo, and he was doing something called looking for the caudal gluteal vessel, which we're going to talk about in just a minute. But folks went down and they watched him do a sample, and here's this big sea lion, and the needle was, you know, I don't know, 8 feet long, I'm sure. Not really, it was about 6 inches. And that sea lion just sat perfectly still, and the needle went in, and a lot of blood came out, and everybody went home happy. So we decided we would try that with the sea lions there, and we were able to utilize that with quite a bit of success. It took us quite a number of sticks, as we call them, needle insertions, to get the blood. When we train the behavior, we only stick once a week because we want to make sure we set up and practice it many, many, many times, reinforcing it heavily. And then just once a week would we actually do a needle. So it took us 11 weeks to get it, but we got it. And so that kind of popped into my mind, and I remembered it. Yes, a vessel not located near flippers, and these guys are happy not to share their flippers anymore. So we talked about it, and the caudal gluteal vessel we have here, there's a little arrow there. This would be as if you were looking at someone's back. This is a vessel that all carnivores have. And it's basically caudal, meaning towards tail, and gluteal, the gluteal or gluteus maximus area. And that's approximately where it's located. The issue is that it is beneath a lot of fat. We'll talk about that in a minute, but the benefits of it are that it's a much bigger vessel. It has much better flow and volume, and it's great for animals, especially that have some flipper sensitivity. Sometimes animals, there are a lot of nerve endings there. The skin is thin, the vessels are close to the surface, so animals that aren't comfortable having their flippers manipulated, this is another good opportunity for them. We were interested in doing this, as I said, we used it with the sea lions on the Discovery, but nobody had really done it here in a long time. Fur seals clearly ready to be signed up for their gluteal sticks. The challenges to this particular vessel are several. One is that it is located well below the skin and the fat and the muscle, and it's what's considered a blind stick. That means that you can get in the vicinity, but you don't have anything to go by. You can't see the vessel like you can in the hind flippers, or when you're at the doctor yourself and you have that tourniquet put on, your vessel pops out very easily. So it's tough to miss. With this particular stick, it's not hard to miss, and it's really just kind of X marks the spot. It can feel like I feel like pin the tail on the patient, you know, you're blindfolded and okay, here I come. Yes, I'm not participating, thank you very much. We talked a little bit about the history. As I mentioned, most of the sea lions that were trained for this and the folks that were doing the stick at the time were no longer here. It is something that requires or benefits from a lot of practice. Again, the vessels that are clear in the flipper, a little bit easier. Something like this, I've seen folks do it that were very, very well practiced at it, and it was just very simple. Other times, if you're at a hospital or an animal hospital or something, you're going to see that it takes a little bit more, and I think everybody benefits when you've got somebody that's a little more comfortable with it, as I think you would all benefit that when you go to the hospital. So I was ready to be signed up for this stick, and it was a long time personal and professional goal. I've always felt strongly that someone in the training department would really benefit the overall healthcare program, because we have so much close contact with the animals we work with. We have a lot of trust built up. I talked to our veterinarian, Dr. Charlie Innes, about this, and it's really personal preference, unless it's a state with a law that says the veterinarian has to draw the blood. But other than that, it's personal preference, and Charlie was very supportive with me learning how to do this. Talked a little bit about why I think it's important. We've known a lot of the animals from the very beginning. This is Ursula and her first pup, Flaherty. Nice Irish fur seal. We're allowed tremendous access. Ursula is very comfortable, as are all of the animals for the future slides and videos will show you. But we were within hours of, we're in there often just moments after the pup's born, and very comfortable with them, and they're very comfortable with us. This is just a nice video of Kitovi, our more recent pup that was born in August, and this is Kathy. She works in our department, and she just has a great way. She's kind of the seal whisperer anyway. But you can see just the kind of relationship that we're able to build from very early on. And this is kind of a nice opportunity too. It's similar to puppies, she's opening her mouth, she's exploring, but she's not trying to bite anybody, she's just feeling it. It's a great time for us. We'll just kind of tickle in their mouth a little bit, and that pays off for us so much in the future. I mean, they're still wild animals. They've definitely been born here, but they're not domesticated. And if we can get comfortable have them be comfortable with us touching them and getting in their mouth, and we don't have to be very concerned in the future. Most animals are going to prefer to run unless they feel cornered and really threatened. So that's why it's so important for us to build these positive relationships. Something else that made sense to me about being able to learn how to do this blood sampling is that we're always around. These are a couple of our sea lions watching one of the trainers doing some little regular cleaning. Again, we build these great trusting relationships. We're out here all the time. It's really, I have to say, I probably have one of the best jobs in the world. I get to hang out with animals all day. Everybody's different. They all have different personalities, and no day is the same. And I think we've really benefited from spending that amount of time, because we just have a lot of animals that allow us to be very hands-on and very comfortable. This is just a little video of this is just some fun play that was happening. This is completely outside of a training session, as almost all of our play is, but we're able to do a lot of training outside just for play. Our training sessions certainly have rewards and reinforcements that the animals enjoy, scratches, touches, play, and fish for sure, but we do have a lot of fun together. And this sea lion, this is just something she enjoyed doing. We found that a lot of the animals just on their own will start to throw toys back and forth to us. Just another fun day. This I just have in here because it makes me laugh, but it's also just a nice example of the animals being comfortable in different parts of the exhibit. Really, there's no area that's off limits for them. We have our kitchen area and our locker room and different things like that, and they're all running around when it's safe and when it's comfortable for them. But this is just a little video of Lou behind the scenes.
The excitement's over now that I have the camera, right? What are you doing here? What mischief do you get into in here? camera on. Oh, look at that.
Oh my goodness, that's why I love my job. The other reason that I think it's a benefit to have a trainer doing blood samples is that we're often around when the animals are very ready, but we're also around when sorry, let me straighten that out. Sometimes the animals aren't ready when we are, but we're always there when they are ready, so it's another good benefit. This, actually, you can mic me if you can. This is,
Maybe later.
so that you could hear somebody in the background calling Lou, come on in, we're going to do our training session. And Lou was doing something that young male seals and sea lions do, and that's practicing to be adult male seals and sea lions. And they do a behavior that we call it the beach master, where they'll pick a threshold and they'll defend that. And so he was about 6 months old, and the sea lions in that pool they're probably 3 years old, and I don't know if you could see their faces, but they're looking at him like, have you lost your mind? You're just a little guy. But he has a very strong sense of himself, and that's why we love him. So I applied for the Cunningham Award. I made my case that I felt very strongly about learning how to do this blood sample, being able to use it because we did have a lot of young animals, had the support of our veterinary staff, for all the reasons that I mentioned. I really appreciated that, and the stars kind of aligned with my desire and need and the opportunity. So thank you to the Cunningham Committee who selected my project. And I went ahead and decided to go to the Marine Mammal Center in California. It's on the other end of the Golden Gate Bridge from San Francisco. It's in a place called Sausalito, out on the Marin Headlands. I'm from San Francisco, so this was coming home week for me. And I communicated with the folks there, and they do a lot of teaching. It's really like a human teaching hospital. They have about 600 animals that come in annually. They primarily have elephant seals, harbor seals, and California sea lions. They do get an occasional fur seal, but as I mentioned in the beginning, the sea lions and the fur seals have the same anatomy, so it was a pretty easy crossover. They were gracious and allowed me to come out, and I spent 3 weeks there. This is just another view. This is a very true to form statue of an adult elephant seal, adult male elephant seal. I don't know if any of you have had the chance to see them, but they're very impressive animals. And one of the things that was interesting to me about this particular place is they are first and foremost a hospital, but they also have visitors, but they want to make sure the visitors see everything that there is to see. And so they actually have fake blood as part of this statue. Male elephant seals, when they joust with each other or try to defend territory, they have very large teeth, and that they've got this proboscis that just swings around willy-nilly when they're fighting, and then their teeth will gash into their necks. It's a very thick layer of blubber there, so most of the time these issues aren't fatal, but you'll see very similar behavior with the seals and sea lions that we have here in terms of just jousting and going for that very thick neck. This is an overview of the Marine Mammal Center. They've been open since the 70s. They had a complete renovation in, I think, 2010 or 11. I don't have that date right, but this was a beautiful transition for them. They really pulled out all the stops. They've got great facilities for rehabbing animals. As with all hospitals, their goal is to get them in and get them out. What's interesting to me about this particular aspect of it is you see the sign that says no noise. Obviously it's a hospital, but they have the elephant seals in the front and the harbor seals, and they keep the sea lions farther back from the public view, primarily because the maternal investment time, elephant seals and harbor seals are with their mothers anywhere from 4 to 8 weeks, and that's about it. They don't tend to imprint, they don't tend to look at anything else as possibly being their mother. They don't tend to fixate on humans as much, whereas sea lions will. They spend about 9 months with their moms, and they're very focused on where their food comes from, so they're a little bit easier to get imprinted or to start to look to humans as something positive. So that's why they kept them a little further back. Just another look at the pens here. It's a beautiful day here. I must say, I was here in September, and it's extraordinary there that time of year. I've got some shots of that later. It's very much like a MASH. You know, they get a lot of animals in. This animal is going through an initial intake exam. Because he's so large, he's probably about 450 pounds or so. They really can't restrain him, so they have to anesthetize him, and then he has his length and his girth, and he's weighed and x-rays taken, and then we draw blood samples as well. So this was my first day. I got there a little bit early and felt like I was back home. That was my commute. Not a bad deal. I was pretty pleased that I chose this place, and there weren't a lot of sea lion hospitals in the Midwest. I went down to the beach in the morning, had a little coffee, had my view. Some people came by riding horses. I thought, all right, this will work okay. This will be my workation. So, then we got down to business, the search for the signs of the caudal gluteal vessel. I'm going to go through this quickly. I don't mean quickly, this is how it was described to me. The way you find the vessel is you find the hips on the animal when they're laying down, you draw a straight line to the spine, you draw a 45-degree angle 1/3 of the way to the tail. Okay. Or you can place your first 2 fingers of each hand on the corresponding hips, keep your fingers on the hips, bring your thumbs to the center of the spine in line with the hips, take one of your hands, keeping the thumb in place, and swing your fingers down from the hips, down a half circle to the spine, and feel for the sweet spot. There, now do it. This will give you, I didn't warn you, there will be blood. In animals that are no longer with us. If you look at the orange line, that is the line at the top where the hips are, and so you would put your hands out there, and the blue line is the spine. So off to the right, the green arrow points to the 1/3 of the way down, so that gives you the vicinity. Or on the left, the green is where you would start your thumbs and swing your finger down. There will be another video of this, but again, you'll be warned. Okay, so this is going to show us the attempt at getting blood. This was a Guadalupe fur seal. It was really an amazing animal. I'd never seen one before. I don't have a great picture of her face included here, but very different nose. If you've been around and seen our fur seals, you know, they totally look like aliens. They have this very interesting nose. They kind of look like bats. But they're so beautiful. But the nose on the Guadalupe looks much more like a dolphin rostrum. It's very long and narrow. It's almost like a handle. But this was one of the attempts I saw. And these are, you know, again, experienced people. And sometimes you get it, sometimes you don't. It's a little bit different on every animal. So you see her feeling along the spine, and she's got her thumb there, and she's just because this animal was so thin, she was really emaciated. She had a pretty good sense of where the vessel was. When you watch people that have done this a lot, they don't even go through those machinations of trying to palpate the spot. They just feel something, go, yep, that sounds good. But I wanted to show this video because what we learned about this particular animal, I don't have the sound on, but in I don't know, another 15 seconds or so, one of the folks that's off to the side says, you know, I had trouble with this the other day. I think there was some scar tissue there, and I wasn't able to get the sample. Now, nobody, you know, obviously if we think about having blood drawn from our arm, this would not at all be comfortable, but it's important to say that the nerve endings are in the skin there. The needle is in a very thick muscle area, so it's not nearly as uncomfortable as we would imagine it. I mean, nobody would sign up for this necessarily, but we needed very much to get blood from this animal. But what we didn't hear, what I'm telling you, is that the woman said, let's give the other side a try, and you're going to see this is what it looks like when it works great. And that communication was really important because they never tried that right side of that seal again. They knew there was scar tissue or some kind of trauma there that wasn't yielding blood, and this is what this particular blood stick looks like when it works really well. And this is why I was so excited to learn this and bring it home. There is an issue with possibly feeling a nerve there. This is not comfortable, I know, to watch. I definitely want to feel for the seal, but when we get around here, you're going to see that I'm really proud of this video. I want to let you know. My angles were great. You folks at WGBH must be thrilled with my work. But this flow is really amazing, and this, in probably half the time it took to look for the vessel on the other side. We've got a full sample, and you can see how quickly that tube fills. Now, the other interesting thing about this for me was that having worked with the sea lions and done the trained blood sampling, where we always made a point of saying, if the seal sits still, if the sea lion sits still, and you put the needle in and you don't get blood and you take the needle out, you still throw a party. The seal did their job, you did your job. That's perfect. The vets would say, oh, but I really wanted blood. But that's okay. Everybody did the best they could. It didn't happen. So what I really was focused on was going in. If I don't get it, I'm going to come out. So it just isn't necessarily in my nature to, I shouldn't say it's not in my nature. In my mind, I very much want to do this one stick in and come right out with blood sample. I had to learn to redirect and move that needle a little bit, and the folks here obviously have to. These animals are ill. If you don't have a blood sample, you're not going to be able to treat them. So it took me a little while to be able to manipulate that needle a little bit. This is a video of a sea lion. Just some of the other things that I observed while I was here. Domoic acid is a toxin that is naturally occurring. It starts with an algae bloom, and it works its way up the food chain. And many sea lions, hundreds of sea lions a few years ago, were coming in with signs of this. It's a neurotoxin, so they're not able to move as well. They can have seizures. They can just not be stable on their feet at all and be very confused. This is a very brief video of what that can look like, and there are very different stages of it at different levels. Oh, I forgot to do the audio on that. That's okay, Tom. I didn't mention it. He just did some barking there, but you can see he's just not real stable. This animal passed away fairly quickly. He was riddled with cancer. Apparently that is something that's coming in and showing up quite a bit with many sea lions up and down the coast of California. The Marine Mammal Center, as well as many of the other rescue and rehabilitation areas, or facilities up and down the coast, are participating and sending samples in. Nobody's really sure why it's happening, but they're just seeing a much higher rate of cancer in sea lions that are coming in. The different levels of domoic acid poisoning. We actually have a couple of sea lions whose moms had mild toxicity from domoic acid, and it depends on when the mom contracts it and what stage the pup is in utero, if they're going to have issues with it. And it seems like the moms of our two sea lions got it very late, but what happened was they had the pup and they just completely rejected it, and forcefully rejected it, and that's just something else you'll see with domoic acid sometimes. This was one of the reasons I went in September, was to get a lot of experience with a lot of animals. And this note was near a big cake that says, "Help yourself, we're celebrating the lowest on-site October patient count since 2007. So I was, Yeah, a little bit bummed out because I wasn't getting exactly the level or numbers of practice I wanted, but I really was getting some great tutelage and did appreciate it, and I did learn it a lot, as you'll see, but I just thought that was very funny. So what we were going to do in the meantime while we're waiting for new patients, this little fellow is Naladio. He was animal that was rescued as a neonate. He was just a day or two old, and so he was living at the Marine Mammal Center until he was moved to a facility in the Midwest. But I really enjoyed him. I'd worked around a lot of sea lion pups before, and one of the pieces of something that was great fun here was that most of the folks there, they can't talk to the animals. These are patients. You guys, you don't want them to be focused on people in any positive way, shape, or form. The fish comes from behind a board, the whole thing. But people actually got to bottle feed this little guy and get photos, and so it was a really nice change, I think, a change of pace for them. And for me, I enjoyed it a lot. We also went on a live dolphin stranding, which is very rare out there. There were some animals that went into Morro Bay. They went very deep into Morro Bay. There were 7 bottlenose dolphins, 5 adults and 2 very young calves. And they worked their way into an area that really was so shallow and very thick mud that the only way to access it was through kayak. And there was no real good, safe way to get in there to help the animals. And somebody was telling me that there were 2 adults that were ill, and 2 other adults would take turns, and they would lift the chin of the ailing dolphins up so they could get some air. They'd come down, and they kept doing that and just lifting their heads up. And one of the little calves swam over to where someone was in a kayak, and she's just sitting there, and he took his little rostrum and he stuck it under the front of the kayak and he lifted it up like they did with the other dolphins. That was amazing. Just great story. What probably happened, can't say for sure, is that those 2 ailing animals passed away, because the next day we were out on a boat trying to find everyone, and there were reports that they were gone from the spot that they had stranded in. So we found 2 calves and 3 adults, and they made their way safely out into the mouth of the bay. The other thing I learned about Morro Bay is they have the biggest burritos of anywhere I've ever seen in my life. Just in case you're ever there. I also got to go to a Giants game. We're killing time, you know. But that was my hometown. I'd never been to that park, so that was exciting. Other great parts of this trip, you know, there were a lot of animals that were sick. There was a lot of death. That was part of the business there, but this is the other part of the business. So that was a great balance to the circle of life, I would say. And being the professional trainer I am, I was trying to help out in any way I could, so make sure you go towards the water. Don't try this at home, I'm a professional. Okay, so we didn't have any live patients, very many live patients. We did learn a lot from animals that had passed away. We were actually able to collect blood from a couple, and then what we learn a lot is through doing necropsies or autopsies on animals, and that's what we're going to see next. So there is blood. It's a video of an autopsy. The interesting thing is that it's part of their exhibit path. Here at the hospital, again, they want everybody to experience what they do there and understand all the different parts about their science and what they're learning. So you'll hear some people in the background talking, and I think it was a school group that came in and watched this. So if it's not your cup of tea or cup of blood, it's time to check your email. So what's going to happen here is this is a video, and what's the person that's doing the necropsy is going to explain how she's digging down to find the caudal gluteal vessel and then point it out for us.
Katie, what are you looking at here?
So,
Did I start? Yeah.
all right, so from skin, got the hips and the spine, palpate down, and then what we did was we dissected back the sub-Q layer, and you're feeling for right where these 2 muscle bodies come together. So one muscle body, the other muscle body, and there's a little divot that you're trying to push down with your finger and feel.
The soft spot.
Yeah, the soft spot. And then right there is the vessel diving, running from the outside of the body, diving in between those muscle bellies going inside.
Wow. And it's really coming at an angle.
Yeah.
Cool. Thank you.
So you can see how easy it is to find. We also had an opportunity to work on animals that were anesthetized, and again, this was just easier for me in general. I knew that they couldn't feel anything, and it gave us a good opportunity to practice. There's a little blood in that tube, by golly. This was the first time I heard the term selfie. I was there and said, I don't know, it's been like 7 months or something, like, okay. And this next video is a chance for me. It's actually, I had the opportunity to try to take blood on this one animal that was anesthetized. And so you get to see the full complement of going ahead and doing that palpation. And there we go.
Calif was brought up. I didn't see another. Do you have more swabs?
What's that?
Do we have more swabs in here?
The blue ones like that? They should be in the top drawer over there. They're not? Oh, then no. You want to watch this and I'll go grab them?
I'll go grab it.
Okay.
We probably could do a.
I did a little dance.
What? What media?
Blair's the red cup.
Oh, yeah. We don't use those here.
I guess we're never really good at that.
Yeah.
So yeah, I did a little dance. I had a friend there that was filming for me, and it was just kind of a last-minute opportunity to give that a try. That was as perfect as it could have been, but it gave me a lot of confidence. But I also came home and said, well, you know, I'm really good at taking blood from anesthetized animals on a table that's this high. That's not always the case, and it's never the case. But I did get a lot more practice with animals that were moving, but it really is an acquired skill, and I did get a lot of practice, and I can completely understand. It's an art and a science. It really is a feel thing, and I do feel much more comfortable, and I'm looking forward to opportunities to try it at home. I don't want to, you know, I was thinking when I said I was much more comfortable working on anesthetized animals, primarily because I was a newbie. I didn't want to cause any harm. I also understood that these animals were sick, and if I did generally what happens is if you do a stick or two and you're not getting it, somebody else comes in, because sometimes folks are just having a bad day. But a lot of times, if you did a blood sample on an animal that was fully conscious, they didn't move any more than this anesthetized animal, because it really is just a pretty simple stick through the back there. So I came home, and I was a complete irritant to my coworkers, because I just ran around with syringes and said, come on, let's practice, let's practice. And it's like, look, we have some other priorities if you don't mind. This is a priority for sure, and this is just the beginning stages of training with Lou. He's the little guy that we saw earlier, being the beach master and the mask stealer. So getting him to lie down for any length of time is kind of a feat in itself. But so really, just the first step is he's got a great lie down. That's his trainer Lindsay in front, and I'm just walking around the back, and that's the first step, just to sit for that. And he knows me too. He's just more saying hi there. He thought I gave him an open mouth signal. But then she just asked him to lay down again, and that was perfect. And the next time we come, we'll probably do that another 4 or 5 times. Then I'll kneel down behind him, and then I'll just maybe get a hand on him. And that's why it takes a little bit more time. You want to make sure the seals are completely comfortable with every step before you move to the next one. And we have more babies. Well, this should come in very handy for a lot of animals down the road. This is Cheedak, and he was a rescue from Alaska. He was at the Alaska Sea Life Aquarium for a while. It's a rehab center. Alaska Sea Life Center, sorry, it's not an aquarium. They do have exhibit path, but they're mainly a hospital. But he was he was left in a little box on the front steps of the Fish and Game person in this little town in Alaska. He was about 250 miles away from where he should have been, so nobody really knows how he got there. But he's the newest addition to our colony and having a great time out there in the nursery. Certainly want to thank several folks, the Cunningham Committee, the Marine Mammal Center, my boss Kathy and the Marine Mammal Department for all of their support, Dr. Innes and the Animal Health Department, and the just amazing and inspiring animals that I get to work with every day. And with that, I will say thank you and see if anyone has questions. Thanks. That's a really good question. She was asking, she noticed on the sketch that it said artery, and do we normally take it from arteries or veins? That was the best example that I could get, and I've always heard it termed a vessel. So we normally wouldn't take blood from an artery because you're just going to run a lot of opportunity to have it continue bleeding. Mm-hmm. Yeah. Sure. The question is, obviously blood has to be taken for just general diagnostics, but is there anything else? Could I expand on any research that's being done with blood? I know that blood samples can be used to look at blood pathogens and different things like that. There might not be something that's active right now in terms of research on particular blood, but I know we bank a lot of blood. There are some projects, research projects that are going on around the world that ask for blood samples that we would send to them, but in-house right now we're not doing anything in particular. Have we ever discovered anything suspicious in blood sample like Sargocystis pinnipedi? Cystis pinnipedi. Boy, that's a new one for me. Can you tell me what that is?
It eats away at the gray seal's livers.
It eats away at the gray seal's livers. Wow, I did not know that.
Have you ever discovered anything like that?
I have not discovered anything like that. That's fascinating. Thank you for sharing that. For me particularly, my main goal is to be able to apply my blood sample or my blood collecting knowledge just with the colony that we have and try to minimize any discomfort and maximize the opportunity that we have to collect their blood when necessary. So I myself don't do any research on it at all. What percentage of the rescues get released? It depends on the year, it depends on what's going on. I couldn't give you a real percentage. I would say it's somewhere around, probably on a good year, like 85%. But again, what they're seeing is a lot of animals with this cancer, and a lot of the cancer seems to be urogenital, so something specific is causing that. If animals come in, I think it was a few years ago, a lot of animals were coming in malnourished. Usually, if they don't have any other problems, you fatten them up and get them back out again. So it depends a lot on what's going on in the colony, but that's also a great way to detect ocean health as well. If you're having a big influx of animals coming in, is there just not enough food out there? Does that have anything to do with climate change? There are a lot of different things that can be asked for sure and some answered. What a great question. She mentioned that I was talking about stranded dolphins, and some people want to put the dolphins back in the water. And does that hurt them or does it help them? It very much depends on the situation. A lot of times, if the least time the animals have been out of the water and on dry land, you have a much better opportunity of having them be healthy enough to be returned. Some things that have happened in the last 5 or 6 years are that we're actually able to do blood samples and run a variety of tests on the beach. So we get real-time data back that lets us know the muscle condition and and I'm not in that department, so I'm just giving you kind of a gross idea. Muscle condition is a big part of it. If an animal that is usually being supported in the water is laying on ground for a while, they're their organs aren't used to that. They're used to being supported in the water. So you start to see a lot of muscle breakdown. You see some organ breakdown. Many years ago, many people did think, let's get them back in the water. That's where they belong. Let's bring them back out. And what the New England Aquarium group and other groups up and down the coast have found is that sometimes that makes it much worse. If those animals, they might look great on the outside, but if their blood work isn't good, what you've done is you put them back in the water, and you're going to be having to separate your resources the next day because they'll be coming up on the beach in different places. So it's a tough question to ask without or to answer without all of the information on a specific stranding, but generally you're always going to be better to wait for the blood samples to come back. And it's very quick, and that's how our team makes decisions now about putting animals back in the water or not. Other than blood samples, what other diagnostics might we do here at the aquarium to help measure their health? We are doing x-rays. Most of the animals are trained for x-rays. Let's see. We do just basic, overall physical checkups like we normally would. We've got some animals that are trained to do ultrasound. We can do drops in the eye to dilate, to do eye exams. We actually have specialists. We have special veterinary ophthalmologists and dental folk and dentists that come in. So anything that we can think of, we will train the animals to do, so we can do diagnostics on them. Sometimes it'll even be something that's happened with our pet, and somebody comes in and is like, oh, I had to give somebody eye drops. So we had an animal that had an eye issue a long time ago, so then everybody learned how to get eye drops, because it's much easier to treat an animal whose eyes are not comfortable if they've already been trained to accept those. Yeah. How much will this improve the success rate for drawing blood compared to the flippers? I hope significantly. We have a very healthy colony, so I don't have a lot of opportunity, but we are training it, and I feel 150% more confident in doing it before I left, for sure. And I feel much more comfortable with the landmarks and watching that dissection come up. So knowing that the flippers they just have problems of their own in terms of delivering enough volume, I feel really confident that this will make a big difference for them. When we have seals coming in from a lot of different colonies into our colony, what's it like to assimilate? Is there friction? Generally, youngsters, probably like youngsters in most species, are just very gregarious and enjoy meeting one another and get together and have a good time. When we introduce adults to each other, we always look at the age range and what the animal's temperaments are like. More often than not, animals get along quite readily. We take precautions. We make sure that they can see each other through a gate and a fence, and they can sniff each other and talk to each other. And if animals seem comfortable, then we'll go ahead and do like a chaperoned introduction, if you will. But sometimes things go very differently than you expected. And for Isaac, that big male that you saw in the video, he's huge. He's immense, and he's gorgeous, and he's strong, and he's just kind of a baby. When he first met the two females, the male fur seals can get to be 600 pounds. The females top out at about 100, so there's a big range there's a big weight range difference there. And the two girls came in. He'd been in quarantine for 30 days, as is the case with all animals that come in from somewhere else. And here come these little gals, and they're just checking him out, and he backed himself into the corner, and he's just staring at him and looking around, and he's been like that with everybody he's met. So sometimes it's a little different than what you expect, but the kids are all great together. What was the original reasoning for drawing blood from flippers? I think because the vessels were so visible. The birthing season in the wild for the seals tends to be about May, June, and July, and it depends on the latitude. So if you're farther north up in Alaska, your window's a lot shorter. So the animals are, they're all born around the same time. But
here in Boston, it's right around the same with us here.
Here in Boston, with the harbor seals, we generally see them around May and June. You'll get a few.
Seeing a lot of pups out there now.
Are you seeing gray seal pups?
Yeah. Not the
yeah.
gray seals, the harbor.
Oh, the harbor
I
seals.
never see one gray seal out there.
No kidding, yeah. The harbor seals are right about now. We have a couple of ours that were born here in May and June, and then everybody thinks that the pup numbers just skyrocket in July because on the 4th of July weekend, everybody finds a seal. There aren't any more seals, there are just more people out there to see them. Are rescued seals ever approved for breeding in captivity? Only animals that are not releasable, and what's deemed non-releasable, a lot of times, sometimes we've had animals that have chronic ear infections. You think you've got it cleared up, and then it reoccurs, and for a diving animal, it would be unfair. The only animals that are ever brought into zoos or aquariums for breeding are ones that can't be released. That's Kitovi, Kitovi, and she's just the second and the most recent northern fur seal born. Ursula's her mom. Ursula has given birth to the 2 pups. She was born in August, and she's a little bigger than that now. She was also the seal that was Kathy was playing with and just kind of scratching. Yeah, she's just got this. A really beautiful personality. She's just very sweet. They all do, but she just is just very comfortable and likes to hang around and is just very curious. And Cheedak, the guy that came in from Alaska, he's like a bulldozer. He's just into everything and romping over everything. He doesn't care who's in his way. I'm going over the top of you. And so they're all very different. Yeah, Cheedak the other day I think pushed one of the sea lions into the water. So just. And Lou was the same way. Lou's very sure of himself. I call him Dustin Pedroia. He's a little guy, but he's got big fire.